Hi, today I want to talk about a condition called accessory navicular that can cause a lot of pain on the inside of the foot. This is your navicular bone. When we're born, this is made of cartilage. By the time we reach our mid-teens, it's all formed of bone, but it actually grows from two places, a main growth center over here and a smaller growth center out here. By the time we're in our teens, those two have usually fused together, but in about 10 to 15% of the population, those two never fuse together, and you end up with what's essentially an extra bone over here. This is often enlarged on this side, and it can often get pressure from the shoe. In and of itself, it's really not a problem. It's okay to have that in two pieces, but that area in between, which is made of cartilage, can become weakened, and it makes this bone much more prone to inflammatory problems later on in life. So looking at this area here, there's actually the attachment of a tendon for the posterior tibialis muscle, which is this one right here. It's a very, very strong tendon and attaches in there. And if it tugs too hard on this bone, it can cause that area that's in between that's weakened to become inflamed. Now, it's most common on people whose feet are flatter than average, because when that foot goes down, that tendon that attaches into that area pulls really hard to pull back. Now again, in addition, this area is often enlarged, and as that foot goes down, it'll shove it right into the shoe and cause pain. So the biggest issue we see with this is people having surgery more than they should. So they've got this bump on the side of their foot, they go into a doctor, they see that this is large, next thing you know, you're having surgery to remove that little piece of bone. But in most cases, surgery isn't necessary. If we can do something under here, support that foot and stop it from jamming into the shoe, and you take tension off that tendon, almost always we can eliminate the pain. And the way you do that is using a decent arch support in your shoe. This is a prefabricated arch support. Many cases, these work great. And if you just go to our website and do a search for accessory bone or accessory navicular bone, you'll find a list of the best over-the-counter devices, both for athletic shoes and for dress shoes that will take stress off that area, stop that foot from going over, take pressure off of this, and take tension off of the tendon. If that's not enough, we can make you a custom orthotic. They tend to work better because they conform closer to the arch and they stop that foot from going down. And again, they take pressure off of it, they stop it from jamming into the shoe, and they reduce tension on it so it doesn't get inflamed. So this is usually an easy problem to treat. Please go to the website, do a search for accessory navicular or accessory bone, and you'll find a bunch of home treatment hints to treat it. If that's not enough, find a podiatrist near you that specializes in biomechanics and orthotic therapy, and they in most cases can help you a lot with that problem. If you like these videos, please subscribe, and thanks for watching.